Ladies and gentlemen, welcome to the second meeting of the COVID-19 Task Force, and welcome to your State Emergency Operations Center. My name's Mike Sprayberry. I'm the co-chair of the task force along with Dr. Betsy Tilson. I'm also the Director of Emergency Management and Office of Recovery and Resiliency. The governor's on his way, so we're going to go ahead and get started. And with that, what we're going to do is I'd like to have everybody introduce themselves and also tell us what agency or association or business that you're representing. Additionally, I would ask that everybody speak into the microphone while we're going through the meeting today. So I'll start to my left with Chief Deputy Secretary Cashwell.
Thank you. Good morning. Pam Cashwell. I'm here on behalf of Secretary Eric Hooks from the North Carolina Department of Public Safety.
Glenn McNeil, Commander of the North Carolina State Highway Patrol.
Todd Hunt, Adjutant General, North Carolina National Guard.
I'm David Smith. I'm Chief Deputy Commissioner, Department of Agriculture.
Good morning. Karen Beck, the North Carolina Department of Agriculture. Push the button.
Hey, I'm Bill Roper, and I'm interim president of the University of North Carolina system.
I'm Chris McClure with the UNC system.
I'm Dr. Gail Thomas with the North Carolina Farm Worker Health Program in the Office of Rural Health.
Good morning. Sarah Bolton, the Office of Governor Cooper.
Good morning. Glenn Wisby, North Carolina Emergency Management Deputy Logistics Chief.
Erin Madison, Office of State Budget and Management.
Good morning. Eddie Buffalo, North Carolina Chiefs of Police Association.
Good morning. Virginia Niehaus, North Carolina Department of Health and Human Services, Division of Public Health.
Good morning. Will Polk, Office of General Counsel, North Carolina Department of Public Safety.
Good morning. Kenny Weatherington, North Carolina Community College System.
exceptionally quickly, which is why we need to move exceptionally quickly as well.
Thank you, Dr. Cohen. And I am very appreciative of folks being willing to come together and serve on this incredibly challenging and rapidly evolving situation, not just in our state, but in our country and in our world. So thank you, and we're so appreciative of the Ready partnership of all of our key stakeholders. We're very, very appreciative of it. As Dr. Cohen said, I will do a little bit of a level set of where we all are so that we know as of today where we are. As Secretary Cohen mentioned, we've been having some work being done in some of our planning sectors. So we'll be doing a very high-level brief report out of some of the work in our planning sectors, but we have a lot of new people at the table as well today, and so we also want to be sure that then the folks who have not been involved in some of our planning sectors, to be able to report out for the rest of the group what we're doing, what you all are doing, and then we can think through moving forward how else we want to be sure our communication is as strong as possible, and that we are all planning together. So we want to hear a lot from you all, but I will give the brief update of where we are for now.
And while the doctor's briefing, those of you sitting over there, you can just swivel your chairs and you can see it on the screen, and so you'll be able to follow right along.
Okay. And with the caveat that when the governor arrives, we will pause, of course, for that and then continue on with our meeting. Okay, so very brief status report as of this morning. As we said we expected, we have started to see more cases as we are testing more, and this again is not a surprise to us, but we are seeing more cases, and this number is changing very rapidly. And actually we have now 12 cases in the state. Still no deaths, which we are very grateful for, but we are starting to see the numbers of our cases coming up. To date, of those cases, all of them have had a known contact, except for one of our most newest ones, which we're still in investigation to understand the source of that potential exposure. We are having some increased capacity in our testing in our lab, and I'm glad to see Dr. Schoen here, who has done an incredible amount of work in really thinking about creative ways to be able to get more testing capability in our labs. So we are able to approve a lot more tests, which is what we've always been wanting to do, to be able to increase the testing. So we've been able to open that door, which we are grateful for lots of reasons. One, we want to be sure that people that we're testing people. Also, the number of people testing is really going to be a very important thing for us to know as we start moving through some of our mitigation strategies, which we will get to. Oh, okay. I was just told to speak up, even though okay. I will project more so. So one of the biggest challenges, I think, as people have been hearing, is our limitation in testing. It has been our biggest barrier and challenge, and we have been working around the clock and thinking about creative ways with public-private partnerships to increase our testing capability. And so we've been able to significantly increase the capacity in the state lab, and also we've been partnering with our private organizations to be able to expand testing statewide. So we're feeling in a better position today than we were yesterday in terms of our testing capability. In addition, on the bottom, you will see the expanding cases in the country. And that on the bottom right, as you know, on Tuesday, the governor declared a state of emergency. As part of that, we are working through some of our mitigation strategies. I will go through those that were announced on Tuesday. And then, as we said, the situation is changing rapidly. So on the bottom right, you will see what was accurate as of yesterday. But some of you may have seen last night that the federal government is also working on having travel restrictions for non-U.S. citizens coming from European countries. And that is new as of last night. Okay, moving on. As we said, the WHO actually last night declared this as a pandemic. That was new as of last night as well. And so we are responding to that as well. On the next slide, again, where we are thinking through the intervals of a pandemic, that we still think we are in that acceleration phase. We still think we're at the early part of this epidemic. And so we are gearing up not only in our containment strategies that you use at the beginning of an epidemic, but that we are also then thinking through what are our community mitigation strategies we need to put into place as we move through the acceleration of this epidemic. The next slide, I briefly had covered that already. These are the travel recommendations, and then that was changed last night, as those of you may be aware. On the next slide, I briefly mentioned this as well. As we said, though, the state of emergency was declared on Tuesday. We are now activating our emergency operations center, having our public health and our human services and our emergency management team co-located here. We are still in our aggressive containment strategies, where we are rapidly identifying and testing and contact tracing, but we are preparing and moving and taking tiered steps towards our mitigation strategy and for the community. And we're also making sure that we are keeping people as informed as possible. We activated our Joint Information Command Center because this has been an incredibly communication-heavy event. And we are maintaining our up-to-date website. And then we also have our hotline through the Poison Control Center is another way that people can access up-to-date information. Next slide.
All right. Thank you, Dr. Tilson. And so, as she said earlier, the governor did sign an executive order that created a state of emergency on March the 10th. And on that date, we actually briefed the state emergency response team, the full, all the membership. And so they're watching, they're participating. We're going to be briefing them each week to let them know where we are as the event unfolds. The Joint Information Center is activated 7 days a week because we want to make sure that accurate information is getting pushed out daily. We're activated at a level 4. We have emergency management staff as well as DHHS staff here with 72-hour operational periods. They're embedded with us and we're working together. I will note that in mid-January, DHHS and Public Health stood up their Public Health Coordination Center, and we embedded it with them. And so there's been a lot of planning and a lot of good work that's been ongoing since mid-January. We're currently under the guidance of our technical lead, Drs. Cohen and Dr. Tilson. We're establishing that operational tempo for planning and tactics meetings. We've been having 2 tactics meetings every day so that we can make sure that we are looking forward into the future and not missing anything. We're developing new products for reporting so that we can keep everybody situationally aware of actually what's happening. We're doing some purchasing of some additional equipment, such as personal protective equipment. And we're also, as I mentioned, conducting future operations planning. One of the things that we've been able to do is, you know, this pandemic is not foreign to us. We experienced one in 2009, so we do have plans, and we've been able to leverage some information in those plans to help us with this event. Thank you, ma'am. Back to you.
Okay, as I alluded to, some of the big efforts, as I alluded to, some of our major efforts are thinking what we call non-pharmaceutical interventions or community mitigation strategies. I think as people are aware, we do not have pharmaceutical interventions at present for this infection, so no vaccines and no medicine. So therefore, we are relying on a lot of our non-pharmaceutical interventions for our community mitigation strategies. And the goal of those community mitigation strategies are to blunt the peak of the spread of the disease so that we're ensuring that we have the resources in order to respond. Next slide. These were the announcements that we had made on Tuesday as our first tier of our community mitigation strategies. And again, a lot of these were focusing on the people that we know are at higher risk for they were to get an infection, and high-risk people we're defining as those over 65 and that have an underlying chronic medical condition or a compromised immune system. And so a lot of our recommendations are around protecting our highest risk people. And so our recommendations that, again, came out on Tuesday as our first tier of mitigation strategies, and these are aligning with our CDC guidelines, but that high-risk people should avoid large crowds and also avoid mass travel, that facilities of residential establishments for high-risk people should restrict visitors. For mass gatherings, we are recommending that event organizers urge anyone who is sick to not attend, to encourage those who are at high risk to not attend, to be sure that they're adopting refund policies to accommodate people, high-risk categories who are not coming, to be able to adopt ways to have people have more space at the mass gatherings, to be sure people are washing hands and having hand sanitizer available, and then washing down surfaces. We are, as I mentioned, the traveler guidance following CDC and state government recommendations, or State Department recommendations, and then people who are returning from high-risk countries to be self-monitoring. And at this time, we are not recommending preemptive school closures. Next slide. We have had some statewide these are mitigation strategies. Those mitigation strategies were for our statewide recommendations. And then for affected areas, we also had additional mitigation strategies that addressed our work settings, that work settings in our affected areas should adopt teleworking technologies to the greatest extent possible, urge their employees who are sick not to come home, and have flexible sick leave benefits to accommodate folks. Thank you, sir. Okay.
Do you want us to finish the brief?
Okay. Okay. I'm almost done. So then I will pause, and to consider staggering at start and end times of our workplaces so that we are limiting the amount of people who are in contact with each other. And then finally, I already mentioned this. Mass gatherings in affected areas, specifically, as we mentioned, people who are at higher risk for having clinical severity, that we are recommending that mass gatherings in the affected areas that specifically target high-risk people. So if a mass gathering that specifically is targeting an elderly population or a set of people with underlying chronic diseases, to consider canceling that mass event that specifically is targeting high-risk people. These are the recommendations that we met on Tuesday. As we mentioned, this is a rapidly evolving situation, and we will be changing recommendations as we see appropriate going forward. Next slide. That ends this part of it, and so I will pause.
Thank you, Dr. Tilson. And at this time, I'd like to recognize Governor Roy Cooper of the great state of North Carolina. Sir.
Thank you, Director Sprayberry. Thank you, Dr. Tilson. Thank you, Dr. Cohen. All of you seated around this table have been working diligently to deal with this issue here facing our state, our country, and our world, in fact. And the key here, I think, is coordination. I've been on the phone and communication with governors in other states. One of the advantages that North Carolina has right now is that we have seen other states that have seen rapid spread of this virus, and we are learning things minute by minute of steps we should take. We have a team involved here who knows about public health, knows about how this virus is spread, and we need to do everything that we can to work to prevent the spread of the virus and also to mitigate. We know that lives are at stake. We also know that all of our lives will change in some way over the next few weeks and months. We know that there will be disappointment. We know that there will be loss of income for people. We know that there will be inconvenience. But I think it's critical for us to realize that we are all in this together, that we will find a way forward for our state, that the number one objective here is to protect the health, safety, and welfare of North Carolinians. And we are committed to that. And we're going to have to make some tough decisions. Some of them will be unpopular, but I think it's critical that we take steps now. One thing that's important to note, that this group has been working since January. We've had people working on this since January. I believe that we are in a good position. We've been recognized across the country as one of the best coordinated emergency management operations in the country. Part of the reason for going ahead and declaring the state of emergency was to bring this coordination about. Co-locating public health here has been critical to that. This afternoon, I will be holding a press conference to talk about additional measures. Dr. Tilson, Dr. Cohen, and Mike, I know, have told you that this is a constantly evolving situation here. And we have been working through the night, looking at steps that other states have taken, and also we are looking at how this has spread, looking at other countries, looking at the data from other countries. It is important to make our decisions based on science, data, and fact, and to side of making sure that we protect the public. So this afternoon we will be announcing some evolving specific recommendations. We know that this morning we learned of 3 new positive cases in our state, 2 in Forsyth County and 1 in Johnston County that may have already been reported in here. And I know that there are other results coming from other parts of the state that we still need to confirm. So there will be additional cases, and this epidemic is going to get worse before it gets better. We all know that. The public health and other leaders in this room have been working around the clock to make sure that our state is prepared and protected. We've had a good working relationship with businesses, with athletic teams, sports leagues, and some of them, as we know, have begun changing their approach to this virus as they see things evolve. And when we convene this afternoon, we will be updating you on our revised guidance and recommendations, and we will be sharing that with you very soon. I hope that we can get some good ideas from you and to tell us what you are seeing in your particular area on the ground. We appreciate and value your work on this critical issue. I know that this is a difficult situation, but like North Carolinians know, we are better when we work together. I am going to be in and out because I am on the phone with people about this issue as we speak, but I want to turn it back over to our co-chairs and to continue this. I will mention, and I know that they are talking about it specifically, the lack of testing supplies from the CDC has been a concern now for a couple of weeks. Know that we are doing everything we possibly can to get more supplies, to get new methods for testing approved, to co-opt our friends in private industry with LabCorp and others. And this does remain a top priority right now to get as many people tested as possible. We've been working with the CDC, and obviously we have now expanded our criteria for people being able to get tests, which is a positive thing, and we're going to continue to work to make sure that we do that. So I'm going to be here for a little while longer, but I want to turn it back over to the co-chairs.
Thank you, Governor. And we're going to go ahead and start doing our planning sector brief out. And First one up is medical surge, and Kimberly Clement from the Office of Emergency Medical Service is going to talk to us about that.
Good morning. Thank you. First, I just want to say we have been working since January to coordinate, collaborate, and communicate with our healthcare partners. It's on. I'll be louder, I promise. And our coordination has included our healthcare association partners, healthcare professional association partners, our healthcare coalitions, and emergency management. We've also done coordination with payers and with many of our different hospital systems, including our public and private sectors, as well as we are working to look at strategies to ensure that we will be able to meet the medical surge requirements. As of right now, we don't have any concerns related to that, but we are looking forward to the items that need to be adjusted or changed so that we can make sure we meet all of those needs.
Thank you, Kimberly. And so you covered scarce medical resources along with that for us?
Certainly. So with the scarce medical resources, we are asking that our healthcare partners with scarce medical resources work through their county emergency managers. We are coordinating with state emergency management and with our healthcare coalitions to fill those resource requests as they come in. We have been filling resource requests for about 2 weeks, and we are working and have been sourcing additional resources over the last couple of days to make sure we maintain those resources as needed.
And while we have you, I'm going to drop down to fatality management. Can you speak to that for us?
Certainly. So I know that there has been a lot of pre-planning related to fatality management. Public health has been working on that, and there has been good coordination, new guidance that has been coming out. So again, just working with those various partners to make sure that's being coordinated and communicated.
Thanks, Kimberly. And next up is non-pharmaceutical interventions, which we call NPI. I'm starting to learn the lingo a little bit. And Dr. Tilson addressed that during her briefing, but do you want to just hit any high points there, ma'am?
I think I covered the main ones. I'm just going to look to my EPI team, to Dr. Davies, Dr. Moore, Evelyn Faust. Is there anything else that you would add beyond my briefing? Okay, we got that one covered.
Thank you, ma'am. And so next up is support services. And what I'll say here is that North Carolina Emergency Management and the State Emergency Response Team, I think that we're uniquely positioned to provide support services to the strong leadership that we have in our DHHS. And so what we are good at is providing interagency coordination, logistics support, planning support, transportation support, the things that are non-medical in nature. That's what we can do. And so we've been working with them. We have a natural relationship with them. I can tell you that we work and meet routinely with public health and OEMS during blue sky days, is what we call, non-event days, where we get briefed up on communicable diseases and things like that, so that we are always try to be as ready as we can be. And so we're proud of our partnership. We continue to work it. Regarding incident management, of course, we have organized over at the Public Health Coordinating Center. I say we, I include public health, OEMS, emergency management. We've organized into the incident management structure under the National Incident Management System. And so we have a unified command here. We are working together with plans, logistics, etc., the medical folks. And so we have an org chart. We brief on a regular battle rhythm. And so as the event continues to unfold, the incident command system is flexible enough so that we can expand it and have more staff, more state emergency response team partners as needed. So at this time, I'm going to turn it over to Tracy Zimmerman from DHHS for an update on communications. Tracy, you have the floor, ma'am.
Thank you. Thank you so much. So we have been working hard on communications well before we set up the Joint Information Center earlier last week. So that is now up and in place. We have a very robust team that's looking to push out information as quickly as possible, but also keeping in mind as accurately as possible. So sometimes that takes a little bit of time, but our goal is to be as fast and transparent and as accurate as we can be. We have a website that was stood up again very quickly. It has a robust amount of information on it. We will continue to look at how to best organize that so people can find information quickly for what they need to be able to continue to move forward and take appropriate preparation and response actions. We will, again, continue to push out information. We are formalizing our stakeholder outreach. There's been much of that going on, again, well before the task force was formed, through regular local health department calls and other outreach with key stakeholders that has now been well expanded. And so you should see, hopefully there may be redundancy built into that, but that's the goal, is to get out information as much as possible. We will also be moving to sharing public dashboards on a daily basis so that folks will know exactly what is happening at the state level. And then lastly, we will be standing up beginning next week a daily media availability so that we can, again, continue to address questions and meet people's needs with that. I just want to echo the advice to make sure you're getting accurate information that's based in fact, and that you all serve as ambassadors to help continue to push out that accurate information. Thank you.
Thank you, Tracy. At this time, I'm going to turn it over to the governor.
I wanted to recognize the president of the University of North Carolina system, Dr. Bill Roper, and wanted to thank him for working in a coordinated way with our staff. With his experience at the CDC, he has been helpful to us, to Dr. Cohen, Dr. Tilson, and others, and wanted him to give a little overview of some recent decisions that have been made at the university, and we thank you for being here, Dr. Roper.
Thank you, Governor, and thank you for your leadership, and the words you spoke just a few minutes ago are pitch perfect. I've had the opportunity to interact with Secretary Cohen and Director Tilson and the other teammates in the last few days. What I'd like to do is just take a couple of minutes to, as you invited, tell you the decisions that we made yesterday and announced for the UNC system. And we're trying, as you all are, surely, to find the right balance between what I'd call prudent action and panic. And I think you're hitting it exactly right. In the UNC system, we have 17 educational institutions and some other affiliates, and it's important for us to most of the time give wide discretion for flexibility across the system. This is not one of those times. What we're trying to do is give direction and act in a coordinated fashion across the system, because, as I'm sure you will understand, if one university within our system makes a decision to pull all study abroad students home today, then the instant thing that happens is parents, students, faculty, and others will inundate us with phone calls. Well, what about our institution? What are you going to do there? So we're determined to move as a system in a coordinated way, making the right decisions at the system level, but still giving lots of flexibility across the system for its implementation. Overarching all of this, and again, Dr. Tilson highlighted this, the virus is here in North Carolina. We can't prevent its entry into our state. But I think as much as possible, everything we are doing needs to be directed at interrupting the transmission of the virus across our state. So the things that we are doing as far as moving from in-person course delivery at the university level to, as much as practicable, online courses, so that we can minimize large classes and the aggregation of students in single locations as much as possible. We sent out a directive yesterday saying that we're not going to have events on our campuses of larger than 100 people unless that it is deemed to be necessary by the chancellor or me. We have banned travel outside the state on university business by everyone, and we're looking at what further things to do on study abroad. I just stress the point, 18 to 22-year-olds are not at high risk. This is not about protecting the health of students on our campuses. Rather, it is trying to prevent them bringing the virus to a university campus and then accelerating the transmission because the grouping of students and then they're going out and exposing lots of other people. We're preparing for further testing and healthcare needs, et cetera. We're coordinating all of this with the state health authorities. Thank you for that. Just final point, we have the copies of the thing we sent out yesterday. We'll be leaving it with you all. If you want to transmit it, that's perfect. Panic is not warranted, and at the same time, treating this as a trivial matter and warning against overreacting is not helpful either. And so I just would say I am absolutely confident we're going to get some things wrong, and tomorrow we'll correct those. But this is an occasion where we shouldn't be held back until we have perfect information before making prudent decisions. That's the point. Thank you, sir.
Thank you, sir. Next, I'd like to invite Superintendent Johnson to give an update. Sir?
Thank you, and thank you, Governor. I will echo what you said, that there will be unpopular decisions, and nothing is more unpopular than whichever decision is made for the public schools. Right now, we're keeping public schools open, and that is at the guidance of our health professionals. We hear from a lot of parents who have the ability to keep their students home and the ability to conduct e-learning and the ability to make sure that their students get the proper nutrition at home. We hear frustration from them that schools are not closed. If, heaven forbid, we have to make the decision to close a school, we will also then have to hear from parents who struggle to keep their children at home, who might not have the internet connection, and we know that there will be students who will not get the nutrition they need during the day. So this is a very important factor where we are weighing all of the considerations that must go into this decision. Unlike the university system, we do have a public school system that is made up of 115 individual districts. So we have been prioritizing for local superintendents to work with their local health officials. And ultimately, the decision for each local community will come down to the local health official and the local superintendent with the guidance that we're working on from the state. I can tell you already we have been in contact with the federal authorities, and we are learning from other states who are going through this currently on what steps they have taken if, heaven forbid, we would have to close schools. And tomorrow we will be having an opportunity for all local superintendents and their staff to join with us in investigating what those e-learning opportunities would look like if we have to get to that point.
Thank you, sir. Mr. Wetherington, community colleges?
If I may, I would like to defer to Andrea Poole, who is our liaison with President Peter Holmes, please.
Thank you.
Thank you, and good morning. We are in many ways in between the university system and public school system, and what the community colleges are. Our community colleges are 58 community colleges, our local institutions, and of course are in contact with our local authorities and have very differing situations across the state in terms of where they are. We are in close contact with the presidents. We are, in many cases, very able to flip courses to an online format, much like the universities have done. But of course, the community colleges also do a lot of training that is not conducive to online instruction. And so those are things that our presidents are thinking through right now, as well as their own employee travel situations. But of course, the system office, in line with the governor's order, has moved to a teleworking status. And so we are working through that in Raleigh right now.
Thank you, Ms. Poole. This time I'd like to recognize Chief Deputy Commissioner Smith from Agriculture.
Thank you very much. Governor, Commissioner Troxler wanted me to convey to you his appreciation for your leadership in leading us through this period of uncertainty. So thank you for that. The Department of Agriculture, many people may not realize, but we have operations in all 100 counties. We have employees in all 100 counties. So communication with those employees is not something we can snap a finger at and accomplish. We really appreciate the Division of Public Health, the information they are providing, because we are trying to push that out to our employees on a daily basis. And we are getting lots of questions from our employees. We're getting lots of questions from the private sector, from anyone that depends on the Department of Agriculture. For example, we are battling rumors about food coming from foreign countries that are contaminated with the virus, particularly anything that may be coming from China. That is just a problem that we have to overcome. We are delivering foods to the school systems, and I was told earlier this week that last fiscal year we set a record in terms of dollars delivered to school systems, to homeless shelters, and the like. Already this month, we are almost approaching that record, and we have 1 quarter to go. So we want to be able to maintain that level of activity. Mr. Troxler fully understands that we are not going to be able to do some of the things that we have been doing, certainly at the pace we're doing. But there are certain things we have to do if commerce is to be maintained. For example, the poultry operations cannot continue operation unless we have an inspector present. So we are doing everything we can to make sure that that takes place. There are some export activities that we have overseen, and we need to make sure that those can go on so that commerce can continue. We appreciate your leadership, and we look, I hate to say this, but we look forward to working with all of you in this, because I really don't look forward to working with you on this. And I have with me my colleague, Dr. Karen Beck. And do you have anything, Dr. Beck? Okay, thank you, Mike.
Thank you, sir. This time I'm going to turn the floor over to Attorney Will Polk to give us a legal update. Sir?
Good morning. Good morning. Thank you, Director Sprayberry, and thanks to the members of the task force for being here. Again, as mentioned before, I am Will Polk with the Department of Public Safety and the legal advisor to the State Emergency Response Team. And just wanted to brief out some just key points of law. There's been a lot of discussion of where we've been as far as the executive order, but wanted to highlight some provisions of that, and also just some of the governors and other entities, legal authorities. And then also I'll turn it over to my colleague here to my right, Virginia Niehaus with the Department of Health and Human Services, to also brief out some of the public health authorities and actions under the executive order. First, just some relevant points just to give the sort of legal underpinnings of the work that we're doing here as far as the task force. Basically, the governor did declare the state of emergency on Tuesday. Within a definition of emergency is an occurrence, imminent threat of widespread or severe damage, and it includes public health. So that is why we are acting under emergency powers. Relevant to that, as far as the trigger of those emergency powers, it does, the Emergency Management Act in Chapter 166A of the General Statutes gives the governor the ability to utilize all available state resources and necessary to deal with this emergency and direct direction of personnel to deal with those emergencies. As we move forward, as far as things in the executive order and future actions that we need to consider, the governor, with the concurrence of the members of the Council of State, can regulate the control and flow of vehicular traffic, which in the executive order, that is the size and transportation waivers that most people are used to hearing in the hurricane context as winter storms, but we're utilizing it now to help expedite the movement of medical equipment and other supplies needed to deal with this emergency so that people can get testing and other things that they need. The governor can also, with concurrence of the Council of State, waive any provision or regulation of ordinance of a state agency which restricts immediate relief of human suffering. And again, some of the actions within the executive order deals with that as far as allowing some waivers as far as various regulatory barriers, and I'll talk about those as well. And then last, the governor, with the concurrence of the Council of State, may perform any other powers and duties that are necessary to promote and secure the safety and protection of the civilian population. So those are some of the legal underpinnings. Other things that could be, if we need to take future actions that are allowed under the Emergency Management Act, is that we could restrict the operation of offices, buildings, establishments, and other places to which people could congregate, movements of people in public places. Some ideas of that typically have been curfews in the past, evacuations like we've done under hurricanes from the Outer Banks, or the things that are reasonably necessary to maintain order during the state of emergency. So those are the powers of the governor. Local jurisdictions also have the ability to declare local states of emergency if they see fit to deal with emergencies within their jurisdictions. With that being said, I'll just run through a quick primer. As Director Sprayberry and Dr. Tilson have noted, the State of Emergency Operations Plan has been executed due to the declaration of emergency, and that's how we're working together to deal with this situation. I mentioned the transportation waivers. Another very key provision is Section 9 of the executive order, which triggers the price gouging laws, which the Attorney General will enforce. Of course, the task force is formalized under the executive order, gives the Office of State Human Resources, provide guidance to state employees as far as the storm. Any federal assistance that will be possibly available gives the Director of Public Safety and Director Sprayberry the ability to reach out for that. It also allows for the utilization of the State Emergency Disaster Relief Fund. As far as other prohibitions, does not restrict any lawful possession of firearms or transportation of ammunition, nor does it restrict alcohol, transportation, sales, et cetera. We get those questions quite commonly during states of emergency. And again, it gives the ability to, again, cover any types of things that we need to deal with this emergency. So those are some of the quick legal underpinnings of some of the work that we've been doing here on the task force. I'll now turn it over to Virginia to talk about the public health side of the emergencies that the state health director and others and local health directors may have to deal with this crisis.
Thanks, Will. So I just wanted to mention there are some public health and DHHS provisions also included in the executive order, provisions emphasizing the state health director and local health director's authorities around surveillance and control measures under General Statute Chapter 130A. There's also flexibility regarding health department staff to enter and sanitize public places based on need and capacity. There are provisions regarding waiver of our existing rules around product type and chemical concentrations used in sanitation of regulated facilities in order for us to come in alignment with CDC guidance around sanitation of facilities. There's also some provisions regarding out-of-state licensure and additional testing resources that allow for healthcare workers from other states to come in and assist, and provisions around Medicaid flexibility to allow us to quickly implement critical coverage policies which will address testing and treatment for our Medicaid beneficiaries and health choice beneficiaries, and to amend and revise policies as needed during the state of emergency. I was also asked this morning to provide just a very brief primer on isolation and quarantine authority. Isolation and quarantine are legal tools the public health system uses to control the spread of communicable diseases and conditions. I'm going to give the technical legal definition of isolation and quarantine. Isolation authority refers to the authority to limit the freedom of movement or action of a person who is infected or reasonably suspected to be infected with a communicable disease or condition, whereas quarantine authority is the ability to limit freedom of movement or action of a person who has been exposed or reasonably expected to be exposed. And there's a little bit more to quarantine authority that I'm not going to go into right at this moment, but it's the difference between infected, suspected to be infected, and exposed or expected to be exposed. North Carolina law permits either a local health director or a state health director to issue isolation and quarantine orders. It's permitted under when 3 conditions are in place, when and for so long as the public health is endangered, when all other reasonable means for correcting the problem have been exhausted, and when an alternative exists. into our communicable disease control measure allows us to align with the most current scientific understanding, but it also poses a challenge as this guidance evolves and keeping up with the guidance as it evolves. The appropriate public health action is based on a reading of our North Carolina Isolation and Quarantine Authority and Control Measure law in conjunction with this most current CDC guidance, acknowledging that the guidance could change at any time. The division is working actively with our local health directors, working closely with them to ensure they have access to the most recent CDC guidance and any DHHS guidance that is put out in alignment with that CDC guidance, template isolation and quarantine orders that are based on this guidance and on North Carolina law, and assistance in applying these resources. Thank you.
Thank you, Virginia. Next, we'll move to Adam Scholler. Sir.
Thank you, Director Sprayberry. So I represent the North Carolina Healthcare Facilities Association, representing nursing facilities across North Carolina. North Carolina's nursing facilities are working hard to care for the more than 30,000 residents in their care across the state, as they do every day. We appreciate Governor Cooper's leadership, as well as Secretary Cohen, Dr. Tilson, as well as the open communication with various agencies within the Department of Health and Human Services. So just briefly, I want to mention what our association has been doing, and then also talk about what facilities across the state are doing, and ask for, in one particular area, help from the members of the public as it relates to visitation in nursing facilities. So as an association, we have more than 350 members across the state, and we're facilitating communication among those members and with various state agencies, including calls, webcasts, and facilitating peer-to-peer learning. We are curating the guidance coming out from various federal and state agencies, and that is evolving as this situation is. And we're providing those resources as well as templates that our members can use to help speed their processes. And we're making that available on our website, and we're removing it from any password walls. So we're making it available both to members and non-members across the state. And also as an association, we're stopping our in-person meetings so that we are not bringing together folks who care for the most vulnerable, consistent with the recommendations. So North Carolina's nursing facilities across the state have infection control policies and procedures, and they are taking steps consistent with the guidance and recommendations from the State Department of Health and Human Services, the CDC, and CMS. Two areas where we have, and we've had good open communication with the State Department of Health and Human Services, two areas of note for nursing facilities. One is personal protective equipment, as there is a shortage, particularly for our facilities when it comes to N95 masks and face shields. There are in various areas of the state other shortages, but those are kind of the two bigger, more widespread areas. For those, we have certainly been encouraging conservation consistent with the direction from OEMS, as well as facilitating kind of that normal communication chain to local emergency management, and then additional support from OEMS and the State Health and Human Services Department. The other item to mention is staffing. Of course, there are more than 20,000 frontline caregivers in North Carolina's nursing facilities. As of today, that is kind of at a steady state, but talking to colleagues across the country, if there is an outbreak in a facility, staffing will be hit hard and quickly, including those that may come into contact and need to be isolated or quarantined. So providing support in continuing to provide care for the residents in that facility while staffing may take a hit will be critically important. One final area just to highlight and ask for help from members of the press in the room and the public. So our association and our more than 350 members across the state are kind of following a two-step process related to COVID-19. One, taking proactive steps to keep it out of the nursing facility, and if it does get in, prevent it from spreading. The individuals in our nursing facilities are frail and elderly. The average age is 80, and they have underlying health conditions. So trying to care for them in a safe and healthy environment is our first priority. In addition to the normal measures, our members across the state have also implemented limiting, screening, and restricting visitors into nursing facilities. This is consistent with recommendations from the CDC, from CMS, from the State Department of Health and Human Services. All these agencies have issued guidance, and our facilities are and have been implementing that. Limiting visitors, facilities are encouraging visits only during certain times or under certain circumstances. Screening visitors, asking them questions about possible symptoms, recent travel, and then restricting visitors who have symptoms of respiratory illness or potential exposure to COVID-19. In addition, family members and visitors can expect that when they enter a nursing facility, they're going to be asked to wash or sanitize their hands, and they may be limited to what areas they can go within a facility. We agree with these recommendations. We think they are appropriate, and for families across the state, the specific actions taken by the nursing facility in which your loved one is a resident may look slightly different one facility to the next, but our members are committed to following these guidelines. And this is really where I ask for help. We urge families of residents of nursing facilities to cooperate with the steps our state's nursing facilities are taking. Individuals with respiratory symptoms or possible COVID-19 exposure, including recent travel to impacted communities, should refrain from visiting, and all family members should take steps to prevent the possible transmission by complying with these new procedures for visitors. Many of our facilities are exploring how they can facilitate other forms of visitation through virtual, Skype, phone, text, those non-person interactions, and we're working to try to facilitate that. But any help this task force and members of the press in the room can help with getting that message out and encouraging families to comply with these enhanced screening, restriction, and limitation policies would be very much appreciated. Thank you.
Adam, can you tell us, and I know that you are working on your strategic planning, if a patient or an employee of a particular facility was tested as positive, can you outline a bit of what the next step of strategy would be? I know it may be a little different depending on the circumstances, but can you tell us what we could expect from the facilities were that to occur?
So it would depend on the individual circumstance, and I don't want to speculate too much, but with the frail elderly populations within our facilities, there are infection control procedures in place, and certainly facilities would follow that. There are reporting requirements related to flu and norovirus, communication with local health departments, and certainly communication with the appropriate state agencies. And so that's what would be followed given the circumstances of a case. But if it does happen, consistent with Secretary Cohen's comments on Tuesday, this population, the severity of the illness is particularly high.
All right, thanks, Adam. And just a heads up, everybody that's on the task force, even if you don't get called on right this minute, we're going to do it around the room before we leave, so everybody will have an opportunity for questions or comments. Next up, I'd like to invite Gary Salamito from NC Chamber for any comments that he may have.
Thank you, Director Sprayberry, Governor, Drs. Tilson and Cohen, for what you're doing and for your leadership. We're hearing a number of different things, but I'll tell you a little bit about what we're doing and then ask for some help also. Our organization, along with other aligned business organizations, are talking regularly about getting the information that you all are putting together out to as many businesses and employers as we can through our different channels that we have. So thank you. The information's been good. The access has been very good to the key folks, and that's helping a lot. To the second point, information and a regular cadence of information out to our businesses of all sizes and sectors is critically important to helping make sure that they can answer the questions of their employees and their families, and to be able to make sure we pay the appropriate level of attention. It is a severe issue, a significant issue. Information, data, and science will help us navigate this, and will help the employers navigate it. So that regular cadence of information as it gets established with a clear person who is leading it, people that are leading it, Governor, Drs. Tilson and Cohen, it really goes a long way when they hear directly from you the tone and the measure of seriousness, while also calming effect that it has from learned professionals is exceptionally helpful. We'll continue to work with other state chambers. We're in constant communication with the state chambers. We're in constant communication with local chambers. We're continuing to push out information and gather information and data from them, from what they're learning, and we'll continue to feed that back in to the process. We are beginning to hear instances of cases where children, spouses, employees of employees who may or may not have been in places that are exposed, may or may not been with companies that have been exposed, beginning to be treated inappropriately with, please don't come to school because your parent worked for so-and-so. A spouse, please don't come to work unless you have a negative test that we can identify. Those things are beginning to happen. So we ask, as you have done so well so far in your communication, Jen, we ask from our members and friends in the press that we be thoughtful of each other during this time period, and we stay with the facts, and we stay with the concern, and we be careful not to ask folks to do things just because they may or may not have a family member who may or may not be with a company, who may or may not have been in an exposed area. So thoughtfulness, kindness, data, and information will go a long way to helping us get through the next few months. And thank you for the opportunity to participate.
Thank you, sir. Now let's move into law enforcement. Chief Buffalo.
Thank you, sir. We've actually been working on a draft agency preparedness guide for local first responders. What that looks like, to drill down on it, is we want to monitor the situation through CDC, through the COVID-19 virus with DHHS and our local health departments. We also want to ensure that local law enforcement agencies are looking at their infection control policies and are consistent with CDC's. Reviewing protocols and policies and procedures to rapidly implement those infection disease policies throughout the local law enforcement agencies. We want agencies to review their hygiene policies and supplies, alcohol-based rubs. We want them to review supplies as it relates to law enforcement PPEs for local law enforcement. We also want to ensure that pre-hospitalization providers will provide patient care and has been medically cleared and fit tested and trained for respirator use as well. So we'll be sending out that. Staff has been working diligently on those preparedness checklists that's going to go out to every law enforcement agency. Also, we're looking at the contingency planning guide. Those look like infection control, workplace protection, and community mitigation. We also are encouraging our local law enforcement agencies across the state to prepare for how they would ensure completion of essential missions or functions of their agency based on a 25% and a 40% reduction in force and what that looks like. Mr. Co-Chair, those particular items and drafts, we're looking at drilling those down today at 2 o'clock and pushing that information out first thing in the morning.
Thanks, Chief. Sounds like a lot of good work going on. Appreciate it. Now I turn over to Colonel McNeil, State Highway Patrol.
Thank you, Director. As Governor Cooper stated, the health, wellness, and safety of all North Carolinians and our visitors remain our highest priority. One of the strengths that we have here in North Carolina is in the law enforcement community. We are well partnered and coordinated with our federal, state, Sheriff's Association, both of our Chiefs Associations, and local law enforcement. And that's through the network that our EM partners have set up, and we have excellent working relationships with our Department of Transportation. So the fact that we are activated now, it just takes our nation to the next level. Grateful for the media being here to help us be a force multiplier with all of the safety messaging that we are trying to get out. Like the Chief stated, the patrol is doing most, if not all, of those activations, and we are grateful to have our role and our part with the task force. I'm pleased to state that I have with me our Deputy Commander, Jeff Gordon, our Major Field Operations, Darrell Conley, and our PIO Director, First Sergeant Baker. Thank you, sir.
Thanks, Colonel. And now would like to hear from Chief Deputy Secretary Tim Moose from Department of Public Safety, Adult Correction, and Juvenile Justice.
Thank you. Good morning. Good morning. We want to thank all of our partners here as we continue to work together to get through the situation. Right now, we have spent the last few weeks educating our employees. We have moved to telework. Community. We are also in the process today of looking at ways to enhance our screening at visitation at our facilities and prisons and juvenile justice, looking at possible suspensions of that in the very near future, also looking at our work release population and how to screen and manage that, as well as increasing telepresence in the future for visitation and also for training.
Thank you, sir. This time, that completes the brief outs. What I'd like to do is, instead of issuing assignments to task force members, I'd like to switch it up a little bit and just do an around the room with all of the task force members, so that if you've already spoken and you have something else to say, if you got an alibi, feel free to speak up. And so, but this is your opportunity to ask questions and or just make any additional comments. And I'll pass the mic, and I'll start with the Chief Deputy Secretary Pam Cashwell of Department of Public Safety.
Thank you, Director Sprayberry. Secretary Hooks has our DPS team very fully engaged, as evidenced by the members who are around this table and who have already spoken. But on his behalf, I would say, because he is constantly enforcing with all of us that collaboration and the marshaling of state resources and the coordination of state resources is so critical. And so I would just say on his behalf, thank you again to all of you who are here. And this is a huge team effort, and we will utilize all of our DPS resources. We will be led by the healthcare science and the wonderful advice that we get daily from our healthcare experts, and then we will work to provide the coordination and the resources necessary to do what we have to do in North Carolina to keep North Carolinians safe. Thank you.
No further. Thank you, Director.
Thank you.
Good morning, Director and colleagues. Todd Hunt, National Guard. So I just want to report out to the rest of my colleagues here that we, National Guard, have integrated our planning team in the COVID-19 task force. I appreciate the support from the whole task force with our planners, and it's been a great event for collaboration. And I'd also like to say that we're in close coordination and discussions with Director Sprayberry and Secretary Hooks on how the National Guard can support our great state in the future as we move forward.
Nothing.
Hi, I'm Dr. Gail Thomas, the Medical Director of the North Carolina Farm Worker Health Program, and I'm very grateful to be invited to be part of the task force and to be a voice for the farm workers. Last year, North Carolina hosted about and depended on the labor of about 80,000 farm workers. Of those, 50,000 were migrants who traveled from their homes to work in our state to harvest our food. And about half of those were here on guest worker visas, mostly from Mexico, again, very far from home. Most migrant workers live in employer-provided housing, which is a group housing situation. So they are in barracks. They are sleeping 4, 5, 6 men to a room. And I have questions and concerns about what we will do if one of those men tests positive. How will we isolate that person? to prevent further spread? And how will we quarantine his workmates, probably his whole camp? And if men are in quarantine but feeling well, will they be allowed to work in the fields? Because we can't take out all of our agricultural workforce at once. Just like our health care providers, we need to make sure that we have men working and women working in the fields. Thank you.
Nothing further this time.
Yes, sir. We continue, state logistics continues to monitor state-to-state mutual aid, which there's been no requests across the borders at this time. We're also working with our business EOC partners at the state level as well as the national level through Persia, and that's going well to maintain supply chains as requests come in. Lastly, if in the event that the state should ask us to support hosting individuals, we have 2 facilities lined up right now to support that with a total of about 64 beds that we can support there, and we continue to look on that forward front if needed. That's it.
Good morning, Erin Madison with OSBM. We've reached out to all of the state agencies, many of you in this room, to start collecting potential needs and impacts related to the virus. We appreciate the responses we've gotten so far. Obviously, as you have updates or new information, please share that. We're rapidly working to put together any potential immediate needs, as well as looking at long-term impacts, staffing issues, and other things. So please just keep us up to date.
I'll just add for the public safety training sector with the community college system, we're already laying plans to work with our outside governing agencies who regulate those training programs to have contingency plans in place. Some of the programs can't easily or are not allowed to be moved to online training, so we will be having to address how we put that time and how we can do that in an expedited manner. And our sister agencies have always been great about helping us come up with contingency plans for past disasters, and we've already started laying in our office the groundwork to get that in place.
And going what Kenny said, I would add to what I said earlier. Well, of course, the protection of our students is what is top of mind. We are also very well aware that our community colleges educate and train much of the workforce that will be responding here with our allied health, our nurses, folks in the facilities, and lab workers. And so we know it's a balancing act. Our colleges are very good at standing up training as needed, and so we are ready and able to be a partner as needed.
I'm Janet Clayton with the North Carolina Association of Local Health Directors. And first and foremost, we do appreciate the support that we are gathering from the State Division of Public Health and DHHS, as well as our other state and local partners. Across all 100 counties, the local health directors and the health department staff have engaged our 8 community agencies and partners such as hospitals, schools, EMS, EM divisions, long-term care facilities, in order to make sure they are receiving the most up-to-date communications as we receive those from our state partners, and to make sure that we are prepared in case when we do have cases in our county. We continue to request support for local public health, for our infrastructure, and not just in emergency needs, but in our day-to-day operations.
Jim Matson, Beaufort County Health Director. I'd like to echo a lot of what she said. Some of the local level concerns that we do have is about the shortage. I know you've said that's the top priority, but we can't even get disinfectant ordered right now for the health departments. We're worried about different decisions amongst the different counties when it comes to things such as the school closures or mass gatherings. Well, one county may do one thing, another county may think differently and do so. Just comes with that. We always want to make our decisions based off of what we feel is right, but that is a concern. So guidance that comes from the state oftentimes helps with that kind of a decision. We are worried about school closures and what to do. We realize that a lot of children depend on the schools for food, and so we're thinking about that at the local levels, and then what to do with the workers who have children that may need daycare if their schools are closed. We also are a little bit concerned as far, we have a contingency plan in place, but we do worry a bit about when, as the acceleration occurs, the communicable disease staff and resources we have going to be pulled pretty thin because we have other public health concerns that continue on that we have to maintain there. That's pretty much it. But I'd also like to say that DPH has been a great source of information, and the briefings that they give to us at the local level is very important. And they've done a great job. We should be proud of them, what they're doing. And I'd also like to echo that emergency management has an environment where they have the local EM working with health departments. It's been going on for a long time, and so those plans that have been in place are a great thing to have now that we are needing them.
Excuse me, who you talking to?
Jeff Horton with the North Carolina Senior Living Association. We represent about 300 adult and family care homes in the state. Of the population of homes, which we don't represent all of them, there's about 1,200 homes, 600 family care, 600 7 beds and up. The vast majority of the residents in our home are frail elderly folks. Of note, most of our homes don't have licensed healthcare professionals. They do have trained staff, but it's a big difference from the skilled nursing environment. Probably some of the biggest challenges we face in this COVID-19 is staffing. There currently is a direct care workforce crisis in this state before COVID-19, and competing with other sectors for staffing is very challenging. So if we have a facility that has an outbreak, it's going to be very difficult to find staff to work there. The other issue is funding. Many of our providers subsist on public monies, state and county special assistance, and Medicaid personal care services. Those funding levels have pretty much been static for about a number of years, and any disruptions in funding, I think, would cause a significant financial hardship. Dave Richard with the department asked me for some items a few days ago that we could submit to him, which I did yesterday, and some of that involves the funding issue and also the issue about personal protective equipment. Many of our providers maybe not have much PPE. Their supplies will probably be exhausted fairly quickly, and I asked him in helping to identify providers and also provide PPE to providers that need that. The other thing I will mention is the Centers for Medicare and Medicaid Services, which regulates nursing homes in the state directly, but they don't regulate our providers, submitted a memo out this past Monday, a revised memo regarding visitation in nursing facilities and measures to take. The Division of Health Service Regulation, which regulates our facilities, had issued guidance last week, but we are asking them for more restrictive guidance. We're having a meeting with them this afternoon, and we're going to ask them to adopt the same guidance that the CMS has issued for SNFs. Thank you.
I'm Dennis Rainey with Affinity Living Group. I'm one of Jeff's members in the largest assisted living, represent the largest assisted living group in North Carolina. And as an operator, I'll confirm everything that Jeff just said. We meet it, we're seeing it every day. I will say, and want to thank DHHS, as well as the private sector support from emergency management for all the information and support we're getting just to get the message out to us and then on to our staff. the information and also trying to correct the misinformation. And we're doing, what we're getting is great information and prompting us to get that information out so our staff is aware and understand, so that our residents and our families are aware. We are caring for 6,000 residents today. There's probably 2 family members for every resident, so we're trying to keep them informed also, and that's a challenge. But we do have a concern also with the staffing, and as well as protecting that staff and protecting our residents. We also are taking restrictive measures on visitation effective today, and I'll support what Adam asked, and that is to get the message out so that families understand we're having to make hard decisions, and those decisions may include them not being able to see their loved one for a bit, but that we are caring for them, and we will do other things like telecommunication, phones, and what have you, so they can communicate. But they may not be able to come into our building because we're concerned, obviously, with the protecting them from the spread of the disease. We're also concerned about our staff and our single mothers. Many of them have 2 jobs. Many of them are trying to care for their children and daycare and schools. And we can't provide daycare in our buildings because that just brings the children into the building. So that is a real concern, and we're going to need some support there somehow so that our families our staff can make sure they've got child coverage so that they can care for our residents. So those are some concerns we've got in the private sector.
Good morning, Karen Yowsey from Catawba County Emergency Management. I am the immediate past president of the North Carolina Emergency Management Association. We represent all layers of emergency management in North Carolina, from the counties to the municipalities to the state, including healthcare providers, schools and universities, and private sector. We work as a team approach in a situation like this, and I think I echo what my colleague from Buncombe County said, in that emergency management and public health in the counties are pretty much in lockstep. We are a support agency, as Director Sprayberry discussed earlier, looking at all kinds of non-medical things that we can do to support. Part of that is to be a liaison, an amplifier of the messages, a force multiplier in whatever ways that we can. The concerns, and I actually spent some time late last night talking with the health director in my county, as we see them today at the county level, is some increased depth to the mass gathering guidance, and in particular for faith-based organizations. They are rattling the email and the phone chain, trying to get some more in-depth guidance. Also, we are struggling, and I'll be honest with that, to come up with solutions for assisting our homeless population in our county that is particularly, and I think most counties, particularly vulnerable due to the comorbidity they have of all kinds of diseases and behavioral health conditions. One of the things that I started hearing last night was from primary care providers who are feeling conflicted guidance from their parent organizations to what they're hearing from the local and state public health as far as who they should be calling if they think they have a suspected case. So that may be something that needs some clarification. And the last is some assistance with the business community. They are really reaching out in a very, very intense way, which is wonderful. Very grateful for it, and we're happy to talk with them and support them in whatever ways that we can. But we may need some additional guidance in how to liaison with them. And I appreciated your words this morning very much on that. Thank you for allowing me to speak.
Again, Zach Moore, State Epidemiologist with DHHS, and I want to echo the thanks from all of our leadership for the proactive response, and just highlight a couple of things, and you can all see the global situation if you can see the screen there, and that, as Dr. Tilson said, we're very much in an escalation phase globally with this pandemic of increasing cases, and in the U.S. nationally, large increase in recent days and weeks, up to almost 1,000 cases and 29 deaths reported as of yesterday through CDC. Here in North Carolina, there was just a release that went out reporting that we have 12 cases, including a North Carolina resident who was tested and remains in another state, but cases in 12 North Carolina residents. We have not yet had cases. All of our cases have either had travel or contact with a known case, but we do expect, as has been said, that there is virus transmitting out there, and as we increase our testing capacity, we expect that those numbers are going to start increasing rapidly. We're very pleased that some of our commercial and academic laboratories are now also able to join in that effort, so that we can all do a better job of understanding this. I would like to especially acknowledge our local health department colleagues and appreciate their participation here. They are working very aggressively both around cases and contact investigations, and if we have outbreaks and things, they will be the point of the spear for all of that, but also as conveners for a communicable disease emergency in their local communities. And we really appreciate their support and hope that all of you around the table, if you haven't already connected with your local health departments, will do so, because they're a tremendous resource. I do want to just echo, and I know others have said it, but I think it's good to repeat, this is a rapidly evolving situation. We learn more about the key factors of this virus every day, sometimes every hour. It's important to recognize that we didn't know this virus existed 3 months ago, and so, you know, we will continue to learn really key things, and so I think it's everyone should expect that the guidance will change, and it should change with new information, and there's a lot to be said for consistency, but in a situation like this, we should expect that we will need to be flexible. And just one epidemiologic concept, if you will permit me, the reproductive number, which is if I'm infected, how many people I will transmit the virus to. We believe, based on the global evidence, that that number is somewhere between 2 and 3, and that's one of the things that we're monitoring. It changes all the time. But with that kind of rate of